Hello, everybody. My name is Elizabeth Garland, and I'm a professor of environmental medicine and public health at the Icahn School of Medicine at Mount Sinai in New York City. And I'm here to talk to you today with Christopher Bland on addressing equity and environmental justice in affordable housing in New York City. We're going to start, since it's an international conference, with the WHO guidelines for indoor air published in 2010, when they gave recommendations for how to reduce health risks from exposures of ambient gases, say from stoves and chemicals, from cleaning supplies, building materials, and furnishings, to try to decrease health risks. In 2014, they updated the guidelines to include health-based recommendations on household cooking, heating, lighting, and the utilization of clean fuels and technologies. In the United States, the Environmental Protection Agency ranks indoor air as one of the top 5 human health risks. Indoor air is typically 2 to 5 times more polluted than outdoor air, owing to the presence of asthma-inducing agents such as mold and toxic chemicals in carpets, paint, and other synthetic materials. This is a picture to show about how our home can make us unhealthy. We can smoke in different rooms. We can have mold and bacteria coming in from our bathrooms. Our bedrooms can have animal dander and hair in and dust mites in our pillows and our mattresses. Our kitchens can have chemicals from cleaning products. We can have particulate matter, carbon monoxide coming in from outdoors, from outdoor air pollution, and we can have chemicals released from the building and from furnishing materials seep in through our. There are also long-term environmental effects on many chemicals. Highly fluorinated chemicals that are found in carpet, furnishing, and even fireproofing foam can cause different kinds of cancers, kidney, testicular, thyroid, as well as infertility. Antimicrobials, which we're using a lot of right now in the time of the pandemic, can produce developmental, hormonal, and reproductive problems. Flame retardants, which have used to be found in children's clothing and nightwear, has been found to lower IQ and to increase hyperactivity in children. The environment can also impact our psychological health. On the right, that's a picture of the Bronx, and this is where our research project took place. And as you can see, it's very crowded. And it's really crowded all the time, 24 hours. I think it's one of the highways in the United States which actually logs in the most trucks per hour ever. And these trucks and cars expose people to particulate matter, especially those that are less than 2.5 micrograms, which are very small. And when you inhale them, those are the ones that go down deep into your lungs because they're so tiny they can go all the way. So about 5 or 6 years ago, a group of research scientists from around the country got together and trying to figure out what kind of methodology we could use to look at our urban families in New York and Chicago. The New York families have one of the highest rates of asthma, and very often that is the leading contributor to that is our housing, our poor housing stock. And the housing challenges that New York City face are huge. Many of the apartments have structural defects and have poor maintenance and have a difficult time getting things fixed. In fact, there's been a couple of lawsuits in the recent years trying to improve. So studying the optimal ventilation for environmental indoor air quality, what we call STOVE IAQ, was a multi-city collaboration started by the Enterprise Green Community, and our collaborating agency was the National Center for Healthy Housing in Washington, D.C. We wanted to see if the ASHRAE 62.2 ventilation standards, which are very high-level air ventilations, and the biggest draw on what we thought would be asthma triggers in the home, and if we improve these ventilation standards, that we would see improved indoor air quality and improved general health measures. We try to
Hello everyone, I'm Christopher Bland, the Program Coordinator for the STOVE IAQ project. So first off, we really wanted to gain a better understanding of our participants. And in order to do this, we wanted to conduct interviews and baseline measurements at baseline, 4 months, and then 8 months. And so in the housing, we tested about 5 or 6 different biomarkers, which was PM 2.5, formaldehyde, which could come from furniture and also plastic and paints, nitrous dioxide, carbon monoxide, and carbon dioxide. We expected. So we asked questions such as household income, housing conditions, pets, comfort, and their safety. And we wanted to ask these questions because these markers can indicate some good socio-demographic nature of our participants. Are they living in poverty? Do they feel safe in their neighborhood or their home? We then conducted a health interview, and we asked about pre-conditions such as asthma, allergies, or any nasal congestions or any nasal symptoms. And we conducted this through the SF-36, which related to quality of life, and questions such as, we asked them, in general, would you say your health is excellent, very good, good, fair, or poor? And these were very much self-reported from the participants. And these kind of give us a good nature of the physical health of our participants and how do they feel about the outlook of their health and the ability to handle the challenge. Now, as far as results, we did realize that nitrogen dioxide was the most prevalent pollutant in control in our study units. And about 68% of control units and about 71% of study units contained a detectable level of nitrogen dioxide. About 17% of controls and 14% of study units had detectable levels of formaldehyde. And also, carbon dioxide levels that were above range were only observed in control units. We found that the concentration of PM 2.5 were much higher in our control units than our study units. But in order to gauge the impacts of our study, we wanted to ask some qualitative questions to our participants and really ask them how they felt about the study and the outlook of their life going forward. So we asked them to rate the quality of the air quality of their home. And a 33-year-old woman from the Bronx says, terrible, they don't care about us in the Bronx. My kids have asthma and it's a nightmare sometimes. In addition, a 60-year-old woman from Brooklyn says, there's always a lot of dust from all the construction going on. It's been like this for the past year. And we really wanted to highlight how the community felt. The community feels like they've been left behind, forgotten, and their health is. We also asked them questions such as, how has participating in the study affected your awareness or knowledge of indoor air quality? A 50-year-old man from the Bronx says, I always turn the exhaust fan on the stove when I'm cooking now. And a 42-year-old woman from the Brooklyn says, I bought an air purifier. It's a really nice one, and it seems to work. This really kind of highlights the behavioral changes and the greater knowledge of air quality. And even if that knowledge is nominal, it is useful. This also highlights the monetary investment of participants in their health. wanting in order to contribute to the betterment of their health by investing in. Now, how can we do our part? Well, from a policy side, we can introduce a smoking ban. And in November 2016, the United States Department of Housing and Development announced a smoke-free policy. This public housing had to realize its effect within 1.5 years, and this affected about 1.2 million residents on over 400,000 New York City public housing residents. Policies such as the New York City Green Housing Policy says that all new construction and substantial rehabilitation projects that receive funding from the Department of Housing Preservation and Development must comply with their version of green housing criteria. Now, what can we do on our part as far as individual actions? Well, we can improve indoor ventilation by replacing gas stoves with low-emission or electric cook stoves. We can also use organically and naturally derived cleaning products and household furniture that can reduce toxic emissions from agents such as formaldehyde. In conclusion, we understand that there's disparate resources among housing developments. Those with wealthier enclaves can afford and also have the support and resources to have better ventilation and better property management than those who do not. We realized that through our study there is evidence of indoor air pollution. Regardless of whether it was this study or control units, we realized that a lot of the units have detectable levels of formaldehyde and nitrogen dioxide, and also elevated levels of carbon dioxide. We also understand that better ventilation. So as far as future directions, we would like that for indoor air quality to be prioritized in all housing developments moving forward. We also realize that environmental injustice can stem from placing developments near bus stops or high traffic areas. I know personally that from the observations that I've seen in the housing, I realized that those that were located next to bus stops had higher detectable levels of carbon monoxide and carbon dioxide. And we also want to realize further expansions of this program. This program can be realized in other cities that are likely to, as New York City. We wanted to thank our collaborators for the study, Enterprise community partners, the staff at the Icahn School of Medicine at Mount Sinai, the University of Illinois at Chicago for all their testing, National Center for Healthy Housing for coordinating the study, and also the LSA Family Health Service for helping us conducting the environmental sampling. We wanted to thank you for your time and listening to us tonight. And here's our contact information if you have any questions or concerns in the future. Thank you.